I got a question asking, I received my labs back and my ferritin is less than 10. Kind of common these days, right? So what would I do? Be sure to subscribe and click the like bell so that you can basically be notified when future iron videos come up. As always, I'll be on here answering questions basically the day the video loads. And then remember, I am a physician, a practicing physician, but I'm not your physician. So it is high value to discuss, any things we talk about in this video that you think might apply to you, with your doctor and find out, hey, are these symptoms? Is iron? Is my levels? Are these related? All right. So the first thing I would do if ferritin levels were less than 10, and look at, do they have associated symptoms? Does the individual have, hair loss? Is there fatigue? Is there elevated heart rate? Do they have depression, anxiety, lack of motivation? Is there chest pain? Decreased just fitness performance? So they feel like, man, just gasping for air as I'm out there, running around. They brain fog, or the nails breaking, brittle, headaches. Those headaches right here, are a super common one with low iron levels. The level of symptoms, it helps us gauge how aggressive we need to be in getting this individual's levels up, to an optimal range, or at a minimum, getting them just out of the acute state of iron deficiency. So secondly, after we've decided, how intense is this person's situation, it is what might be causing the low ferritin in the first place. I'm all about the cause. How deep can we get in? How deep to the cause can we get, to the root can we get, so that this is, we actually help the person indefinitely. So, is this acute blood loss? Is this chronic blood loss? Is it pregnancy? Did the blood loss, come through the digestive tract? Is it from, running all the time on hard pavement? Is it from a lack of iron absorption? Is it a lack of iron intake from their food routine? Are they vegan? Are they vegetarian? Are they on acid blocking medications, proton pump inhibitors? Are they on birth control? Is it, antihistamines? Do they have, a bunch of food allergies or food intolerances? A lot of things where they're basically, it's hard for them to eat a whole lot of different types of food. Do they have celiac disease? Are they just eating the standard American diet and not getting any nourishment at all? They're straight malnourished. Is it, copper? Is it zinc? Is it molybdenum? Is it vitamin A? Looking at all these different nutrients, is there an underlying autoimmune chronic inflammatory response going on that could be, affecting absorption? Do they have hypothyroidism? Hypothyroidism is a super common cause of, malabsorption of lower hydrochloric acid levels in the stomach, leading to poor iron uptake. So there's so many things to consider beyond, is it just, a menstruating female? But the most commonly, when we find related to iron deficiency and a ferritin, especially under 10, is, in the chronic bleeding state. A menstruating active female who's, having a cycle, a period every month, and losing blood via their period, and essentially not recouping enough from the food inputs that they're consuming. In these cases, they're usually pretty straightforward, and essentially it's like, man, take 2 blood vitality capsules, try it on an empty stomach, and see, over the next 6 weeks if you don't see a significant upkick in your ferritin levels, and then keep checking every 6 weeks, making sure that that your iron levels are coming up sufficiently, and along with that, symptom changes are happening. And then, like, how can we make, without using birth control, without using hormones, how can we make your cycle less intense, your period, your blood loss less intense? And on top of that, there's of course like food adjustments. Those are usually the foundation. But when it comes to iron deficiency and B12 deficiency, I really haven't seen people be able to normalize their levels with just food. Once your levels get so depleted, these nutrients are not easily extractable and absorbed by the body in the first place. So once you get low, it's like, man, B12, iron, you almost have to supplement to get your levels up. And once you get them up, you can often sustain with food, unless you are a menstruating woman. Then often, we're basically saying, hey, continue taking blood vitality during your periods, because during your period is when iron uptake is at its highest, any from 1 to 3 times absorption rate when you're taking iron during a bleeding or during your period there. And blood vitality, you can check it out. We'll put a link below for that one. If you're not talking about a menstruating female, then I would look for blood in the stool, get a fecal occult blood test. Make sure you're not losing blood via your stool, via small intestine, large intestine, stomach, somewhere in there. And, if this is positive, then we need to, go down a whole nother route and figure out where is that blood coming from and why is it in my stool? Because that's not normal. And so you might need an endoscopy, might need a colonoscopy, might need both of them. And then it gets back to, one, sure, supplementing with, I would say, the most digestible iron supplement I found, like Blood Vitality, along with using, agents that will heal up the digestive tract and the digestive areas that are challenged, or, it depends on what the condition is. If it's an acute colitis, if it's, chronic, if it's, it's coming from a stomach ulcer, if it's Crohn's, if it's ulcerative colitis, it really depends on that. That's an intense, long conversation about what we're all going to do to actually kill the root there. And then there's the vegetarian or the vegan, the person who's chosen a lifestyle where they're pretty much going to have to supplement ongoing unless they have very, very specific mechanisms that are just genetically enhanced that enable them to maintain and hold on to a lot of iron, or extract it from foods, from vegetables that's greater than most people. And in those cases, it's like, Blood Vitality, 2 capsules a day, ideal on an empty stomach in the morning. If your ferritin's less than 10, let's retest it, about every 6 weeks. Make sure your levels are progressing in a positive manner, and until we find that place where the person feels awesome, and they find that range about 50 to 120 nanograms per milliliter for ferritin levels. And that's what I've found, and I think a lot of literature suggests that's also accurate as far as a level that is all benefit and no risk related to iron. Now, if medications are on board, then we have to go to work, find out like, okay, what is a natural solution to the suppressive drug regimen that I'm on for the condition or the symptom picture that I have. And so we need to go in deep, find ourselves, okay, how can we get this person out of these medications so they don't need to be just held up by medications? Because in the end, usually if you're using suppressive medications, then supplementing with iron, you're gonna have to supplement more and more and more and more, and you never quite get over the top where you're like, man, I feel amazing. And I cannot stress enough the importance at looking at your whole being and just not fixating on your ferritin levels. Ask why. Don't wait until and if you are supplementing, don't just wait until your ferritin levels are normal to go back and assess why your ferritin levels were low in the first place. Why are they not optimal? Why am I having this whole experience of low iron? Start healing the root while you're bringing your iron levels up. Now, if you want more action steps to get your iron levels up, then please check out the Iron Guide. It's free. And all the other videos that I've made related to maximizing iron absorption, maximizing utilization, looking at all these different factors and lifestyle traits that might lead to low iron levels. Because I know it's a thing that it's terrible, and no one wants to suffer with low iron levels when it's a simple fix often. You can also check out Blood Vitality. That's the iron supplement I was speaking of. I've seen that to be the most efficient supplement in my practice for those suffering with iron deficiency, getting super fast results, and not having all the digestive distress and the side effects that often come along with standard iron supplementation. All right, so if this video is helpful, man, like it. Let us know below, your iron deficiency story, how you overcame, what's worked for you, and maybe what was the underlying cause of your iron deficiency, so others can see and maybe find that, whoa, that gels. I hear you. That's what I was thinking. That's what I was noticing, and they can then take it to their physician and get help. All right, I'll talk to you guys and gals later.